Understanding organ transplantation. Hope, challenges, and modern medicine's greatest gift. Introduction. Organ transplantation stands as one of modern medicine's most remarkable achievements, representing the intersection of surgical innovation, medical science, and human generosity. This life-saving procedure offers hope to hundreds of thousands of individuals facing organ failure, transforming fatal conditions into manageable health situations and giving countless people a second chance at life. The current state of organ transplantation, a growing need. The gap between organ availability and demand continues to present one of healthcare's most pressing challenges. In the United States alone, over 103,000 individuals currently await organ transplants, including more than 2,000 children. Despite performing over 46,000 transplants in 2023, the medical community still struggles to meet the overwhelming demand for organs. Understanding the urgency. The stakes couldn't be higher in the realm of organ transplantation. Every day, approximately 17 Americans lose their lives while waiting for a life-saving organ. This sobering statistic underscores the critical importance of organ donation and the ongoing efforts to expand the donor pool. The journey to transplantation, qualifying for a transplant. The path to receiving an organ transplant begins with a comprehensive medical evaluation. Healthcare providers must determine not only the medical necessity, but also assess whether a patient can physically withstand the rigors of transplant surgery and the subsequent recovery process. Conditions that might necessitate organ transplantation include inherited genetic disorders, progressive organ diseases, severe trauma or injury, chronic medical conditions, viral infections leading to organ damage, autoimmune disorders affecting organ function, the waiting process. Once approved for transplantation, patients enter a complex waiting system managed by the Organ Procurement and Transplantation Network. This organization oversees a sophisticated matching process that considers multiple factors. 1. Medical urgency. 2. Blood type compatibility. 3. Time spent on the waiting list. 4. Geographic distance between donor and recipient. 5. Size matching, particularly important for certain organs. 6. Tissue type compatibility, types of organ donation. Living donation. Living donors represent a crucial source of organs, particularly for kidney transplantation. These generous individuals can donate one kidney, a portion of their liver, a lung lobe, part of their pancreas, segments of intestine. The ability to donate while living has significantly expanded the donor pool and improved outcomes for many recipients, as living donor organs typically function longer than those from deceased donors. Deceased donor transplantation offers the opportunity to help multiple recipients from a single donor. One deceased donor can potentially save up to 8 lives through organ donation, enhance the lives of over 100 people through tissue donation, provide various organs including hearts, lungs, livers, kidneys, pancreases, and intestines. Donate corneas, skin, bones, and heart valves. The transplantation process. Pre-transplant preparation. When a matching organ becomes available, events unfold rapidly. 1. The transplant center contacts the recipient. 2. The recipient must arrive at the hospital quickly. 3. Final compatibility tests are performed. 4. The surgical team prepares for the operation. The surgery. Transplant surgery represents one of medicine's most complex procedures, requiring highly skilled surgical teams, precise timing, sophisticated preservation techniques, careful monitoring of vital signs, expert anesthesia management, post-transplant care. The post-transplant period is crucial for success. 1. Initial recovery, close monitoring in intensive care, careful management of pain and vital signs, immediate detection of potential complications. 2. Long-term management, regular medical checkups, immunosuppressive medication, lifestyle modifications, infection prevention strategies, living with a transplanted organ, the role of anti-rejection medications. Recipients must commit to a lifelong regimen of immunosuppressive medications. These drugs prevent organ rejection, require careful dosing and monitoring, can increase susceptibility to infections, may have side effects requiring management / lifestyle adjustments. Successful transplant recipients often need to make significant lifestyle changes. 1. Dietary modifications. Balanced nutrition, reduced sodium intake, careful food safety practices. 2. Activity guidelines. Gradual return to physical activity. Regular exercise as approved by healthcare team. Avoidance of high-risk activities initially. 3. Infection. Prevention. Regular hand washing. Avoiding crowds during peak illness seasons. Maintaining vaccination schedules. Prompt attention to any signs of illness. The future of organ transplantation. Emerging technologies. The field continues to advance through 1. Improved preservation techniques. Extended organ viability times. Better preservation solutions. Machine perfusion technology. 2. Surgical innovations. Minimally invasive approaches. Robotic-assisted procedures. Enhanced imaging techniques. 3. Research developments. Xenotransplantation studies. Tissue engineering advances. Stem cell applications. Ethical considerations. The field of organ transplantation faces ongoing ethical challenges. Organ allocation priorities, living donor risks and benefits, financial aspects of transplantation, access to transplant services, international organ trafficking concerns, supporting the transplant community, becoming a donor. Despite widespread support for organ donation, 95% of Americans, only 58% are registered donors. Increasing donation rates requires 1. Education about the donation process. 2. Dispelling common myths. 3. Making registration more accessible. 4. Encouraging family discussions about donation, financial considerations. Understanding the financial aspects of transplantation is crucial. Insurance coverage requirements. Medication costs. Long-term care expenses. Support programs and resources. Conclusion. Organ transplantation represents both the tremendous achievements of modern medicine and the extraordinary capacity for human generosity. While challenges remain in meeting the demand for organs, continued advances in technology, surgical techniques, and public awareness offer hope for the future. The success of organ transplantation depends on the entire community: medical professionals, donors and their families, recipients, and support networks. By understanding and supporting this vital medical procedure, we can all contribute to its continued success and help save more lives through the gift of organ donation. For those considering organ donation or awaiting transplantation, consulting with healthcare providers and transplant centers remains the best source of personalized information and guidance. Through continued research, education, and community support, the field of organ transplantation will continue to evolve and offer hope to those in need.